Mr. Speaker, the next area is mental health. The Prime Minister and her predecessor rightly prioritised the treatment of mental health so we can ensure that mental health finally gets parity with physical health. The £33.9 billion cash term settlement, which is the longest and the largest cash settlement in the history of the NHS, includes a record £2.3 billion extra in real terms for the expansion of mental health services. The framework sets out how 380,000 more adults and 345,000 more children and young people will get access to mental health support. And I want to pay tribute to...
That was former Health Secretary Matt Hancock speaking in Parliament as he launched the NHS long-term plan in 2019. As you heard there, the plan committed to spending an extra £2.3 billion per year on mental health services by March 2024, some of which was reserved for setting up community teams, including pharmacists, for patients with severe mental illness. But now that March 2024 has come and gone, we're asking whether that money for community teams has been spent as intended, and what happens now that the funding pipeline has dried up. Welcome to the PJ Pod, brought to you by the Pharmaceutical Journal, the Royal Pharmaceutical Society's official journal. I'm Executive Editor Carolyn Wickware, and in this Spotlight episode, I'll be putting those questions to our reporter, Tammy Lovell, who's been speaking to specialist mental health pharmacists and mental health trusts to find out how services have changed since those remarks in 2019. Hello, Tammy.
Hi, Carolyn.
Now, the government has been looking to improve mental health care for many years. What did the long-term plan offer that hadn't been offered before?
So the long-term plan set goals to expand mental health services and allow faster access to community and crisis mental health services. One of the ambitions of this plan was to create, and I quote, new and integrated models of primary and community mental health care to support 370,000 adults and older adults with severe mental illness by the end of March 2024.
Why is it that cohort that doesn't always get the right care?
Yeah, people with severe mental illness can often be too ill for community mental health services, but not unwell enough for acute care. This is when people can end up presenting at emergency services or being detained under the Mental Health Act because there isn't the community mental health support available. So the idea of these integrated primary and community mental health teams is to stop people with severe mental illness from falling through the gaps by providing support for them to live as well as possible in the community.
What commitments did it make for pharmacy specifically, though?
So in addition to providing access to doctors, nurses and psychologists, these integrated teams would include wider services such as employment support workers, occupational therapists, housing support workers, social workers and crucially pharmacists. The plan set a target for 260 pharmacists to be employed in these integrated mental health teams by March 2024.
Right, okay. And can you just explain to us what would classify as a severe mental illness?
So that includes people with psychosis, bipolar disorder, personality disorder diagnosis, eating disorders, severe depression, and mental health rehabilitation needs. And some of these may also be coexisting with other conditions such as frailty, cognitive impairment, neurodevelopmental conditions, or substance use.
Why is it so important to have pharmacists on these teams?
So unfortunately, it's well known that people with severe mental health illnesses tend to die 15 to 20 years earlier than the general population. And one of the reasons for this is comorbidities. People with severe mental illnesses are at more risk of poor physical health problems such as obesity, asthma, diabetes, COPD and cardiovascular disease. And also, people with long-standing mental health illness are more likely to smoke. So part of the role of the community mental health teams isn't just to focus on the patient's mental health, but to look at them holistically. This can include physical health checks, and it also includes access to services such as housing or maybe support finding a job. Also, because patients may be taking lots of different medications, including psychotropic medications like clozapine, lithium, valproate and antidepressants, medicine optimisation is really vital. And this is where pharmacists come in as the experts in medicine.
There's lots of knowledge pharmacists could offer, I'm sure. So what does the day-to-day job involve for pharmacists working on these teams?
So I spoke to a clinical pharmacist working across 11 community mental health teams for South London and Maudsley NHS Foundation Trust, which is known as SLAM. She told me that on a day-to-day basis, she'd deal with patients who could have complex medication regimes, and some of these patients are treatment resistant, so she would carry out medications reviews to create really individualised treatment plans for them. But she did say that quite often patients don't actually even need their medicine changing necessarily. Sometimes they might just need some reassurance and support from a pharmacist about the side effects they're experiencing and how to mitigate those. As well as seeing patients directly, she also does quality improvement audit work. She told me she'd been looking into patients on high-dose antipsychotic therapy above the BNF maximum dose to check if the high dose is necessary and if their treatment is safe and effective. She also checks if patients are up to date with their physical health monitoring and whether they've developed any comorbidities since being on high-dose therapy.
That sounds like a really diverse and important role in patient care. I guess the obvious next question is, did hospital trusts hit their target? Are those pharmacists in place?
Yeah, so that's one of the things that I wanted to investigate. I sent FOI requests to all 49 mental health trusts in England in January, asking about the number of pharmacists employed in adult mental health community teams between 2019, when the long-term plan was published, and 2024. We got data from 43 trusts which recorded that there were around 161 whole-time equivalent pharmacist posts in these teams in March 2023. Also, 36 of the mental health trusts provided data about the number of pharmacists employed in 2019 when the NHS long-term plan was published. There were just 27 whole-time equivalent pharmacists in post in community mental health teams in 2019 to 20, compared to 128 pharmacists in 2023 to 4. So we can see that although there's definitely been good progress towards meeting the target over the last 5 years, we can safely assume that the target hasn't been met.
I'd say so. Well done on getting to the bottom of that. I know you've been talking to lots of pharmacists working in mental health about the reasons why the target may have been missed. What have you found out?
Although overall there's been good progress towards meeting the target, there's some areas that haven't started their mental health transformation yet or haven't employed any pharmacists at all. Some trusts I spoke to gave me different reasons for this. One of the key reasons is funding. Although there was a target to employ 260 pharmacists, there was no funding actually ring-fenced for this. So in a way it's down to each area to decide what their priorities are. It's a really variable picture across the country. Some areas were already ahead in 2019 and had pharmacists as part of their community teams already, so they may have chosen not to take on any more. For example, SLAM has maintained 4 full-time pharmacists since 2019. Other areas may not even have any pharmacists, so they're really starting from scratch. One of the issues Karen Shuker, president of the College of Mental Health Pharmacy, pointed out to me was that unless people have experience working with a pharmacist in their team, they may not actually be aware of the value that they can bring, so they may not prioritise them. For example, Avon and Wiltshire Mental Health Partnership NHS Trust told me that they'd chosen not to take on any pharmacists because, although they said they recognised the contribution of pharmacy professionals, they said they needed to prioritise other areas for funding.
Right, okay. Have pharmacy workforce issues played into this at all?
In some areas, they have had difficulty recruiting. We know that the southwest of England in particular has workforce issues, and Somerset NHS Foundation Trust told me that they tried several times to recruit a pharmacist, but they couldn't find anyone suited for the job, so they ended up taking on a pharmacy technician instead. Of course, it's great that they still have that pharmacy expertise, but a pharmacy technician is obviously going to bring a different set of skills than a pharmacist would.
There was supposed to be training to support pharmacists into these roles. What happened with that?
Yes, Health Education England, which is part of the NHS England's Workforce Training and Education Directorate now, has been funding a specialist mental health training pathway at the University of Bradford since 2021, which is specifically designed to equip pharmacists taking on these new roles in community mental health teams. Unfortunately, the course hasn't been as popular as expected. For the past 2 years, they've offered 70 funded places, but they've only filled about 50% of them.
Why has the uptake been so low?
NHS England told me that the enrolment figures reflect the fact that pharmacy employers are still recruited into these new pharmacy roles in community mental health teams. They also said that not all recruits require the training, as some are already equipped with the necessary skills.
And now that March 2024 has come and gone, is the training continuing?
Well, the university's just taken on a new cohort, which will finish in March next year. They're not sure yet if they'll receive funding from NHS England to continue the training beyond 2025.
And what happens next for these teams and their patients?
This mental health transformation is still ongoing, and some areas are only just starting to set up their teams now. Some trusts told me that although they haven't employed any pharmacists yet, they're planning to recruit in the coming year. Matthew Ellswood, National Specialty Advisor for Mental Health Pharmacy at NHS England, told me that he's going to be carrying out an evaluation of the community mental health teams to bring together a summary of what's been learned through the implementation of pharmacy roles. He wants to use this research to develop a policy evidence document to support trusts in making decisions about whether they should invest in pharmacists for these roles. Ellswood also told me that he's really encouraged by the progress that's been made over the last 5 years, and that at the same time he'd love to see more development and growth in the sector. In his words, it's about getting specialist mental health pharmacy support into the teams, embedding those roles, optimising, and finding out what's going to work in different locations.
Well, that's a surprisingly positive outcome for these teams and for the patients that they look after, that there may be some longevity to them even though the 5-year plan has ended. Thank you, Tammy, for that insight into your investigation.
Thanks for having me.
While I've still got you, if you're interested in joining the Royal Pharmaceutical Society to access a range of member benefits, including the Pharmaceutical Journal's news, features, and learning resources, you can do so for the equivalent of just 60p a day. Just search RPS membership to find out more. As ever, if any of our listeners want to get in touch on social media, use the hashtag PJPod or email us at editor@pharmaceutical-journal.com. We're always happy to hear any of your ideas for the podcast. This Spotlight episode is part of the May digital issue, which can be found on our homepage, pharmaceutical-journal.com. Bye for now.
Bye.